Hello, my name is Gabriel Cuesta, and I am going to be discussing the temporomandibular joint, otherwise known as the TMJ. TMJ is located laterally, just anterior of the ear. It is the part where the mandibular bone, otherwise known as the jawbone, articulates with the temporal bone. The temporal bone is in the middle portion, specifically right where the frontal plane dissects the anterior and posterior aspects of the body, and it also contains the temporal process. The articulation actually takes place in the mandibular fossa, which is in the underneath part of the skull. Okay, so here is a drawing of the joint itself. Okay, so the temporal process is a part of the bone that sticks out from the actual temporal bone, which is on the lateral aspect of the head. The side that you're looking at is the right side of the body. So the articulating surface on the temporal bone will highlight in yellow. Okay, the mandible will be in orange. Okay, once again, this is the jawbone, and the articulation is actually taking place in this blue area right here. Okay, once again, that's the fossa. Okay, the temporal process also, there's a suture that's right over here for the zygomatic bone. All right, so a person who, actually the functions of this articulation result in depression, which is the jaw moving downward. Okay, elevation, which is the jaw moving back upward. This aids in mastication of food. Also, protrusion, which is moving the jaw forward, and adduction, moving the jaw backwards. Okay, the jaw can also move medially, which would be towards this way. Okay, so actually, it will move laterally, right, toward the outside, and then back again medially to center itself. That takes place with several muscles. There's several muscles that run along the jaw in different directions, which allow those different movements. So kind of showing on my own face how these movements work. So once again, depression, opening of the mouth, elevation, closing. Okay. Protrusion would be actually bringing it forward, and adduction bringing it back, or even tucking the jaw back. All right. Kind of. So in the drawing, so if a person were to show a dislocation, typically these dislocations happen anteriorly. So the actual articulation point of the mandible will then move anteriorly to the protrusion of the mandibular fossa. So this bone would actually come out this way. Okay, so way that it would be shown if the person were to come into, say, an emergency room with a dislocation, the patient would more than likely be unable to close the jaw and will more than likely have their mouth open. Okay, so that can happen from trauma, possibly hitting it under the chin, knocking the jaw forward, maybe even the back of the jaw. There could be various reasons why the mandible may dislocate at that joint. More than likely trauma. Okay. So complaints as far as articulating a complaint, the patient may have a hard time doing that, but it could be fairly obvious. Now, when the joint or the dislocation is going to be reduced, which is medical terminology for putting it back in place. The process is to actually apply pressure to the molars. So based on the drawing, the molars would be right around here. Okay, on both sides, you would depress with the thumb, bringing down the mandible. Okay, so then the mandible would move downward, and then pushing it posteriorly, okay, to where in essence the head of the mandible will then come back in place into the fossa. At that point, the mandible is considered to be reduced. So that is my depiction of the TMJ. I was about to say joint, but that would be redundant. The TMJ, and how a patient would illustrate or demonstrate a subluxation or a complete separation of the bone from the joint, and how it could be reduced.